I'm Dr. Keith C. Ferdinand, the Gerald S. Barrison Chair in Preventive Cardiology at the Tulane University School of Medicine in New Orleans, Louisiana. Join me on Wednesday, October 21st, the impact of ethnicity and race in cardiometabolic health, implications for risk assessment and management. This virtual symposium will first discuss the role of race, ethnicity, and social factors in cardiometabolic health. I'll look at some of the factors that are related to what's called the social determinants of health, where we work, live, and play, and how they impact our overall health. Enrique Caballero will discuss managing type 2 diabetes in Hispanic and Latino populations. Daniel Munez will then talk about the unique concept of polypills for hypertension in racial and ethnic minorities. And finally, before we have an expert panel discussion, Deidre Martino is going to discuss evolving treatment paradigms and new therapies, new guidelines, but at what cost. The expert panel discussion that follows will include myself and Enrique Caballero, Carol Harshaw Ellis, Deidre Martina, and Daniel Munez. The second component of our October 21st symposium will be a primetime CME symposium from the ABC, Association of Black Cardiologists, in which we will discuss our Access to Care initiative, overcoming disparities and gaps in the diagnosis and treatment of familial hypercholesterolemia. We will have very compelling discussion from Christy Ballantyne and Stephen Kopecki, and we will have a unique presentation from a patient with familial hypercholesterolemia, Chad Gadney. He's a young man who has experienced the ravages of cardiovascular disease related to his genetic factors that increase cholesterol. In this particular session, we're going to have a discussion from Leona Corsino on diabetes and cardiovascular outcomes. We'll then have a discussion from Carlos Rodriguez on racial and ethnic differences in cardiometabolic risk factors. And finally, Alana Morris will discuss how you should counsel your patients who live in food deserts. Please join us Wednesday, October 21st, the impact of ethnicity and race in cardiometabolic health, implications for risk assessment and management.